Today, we are stepping up advocacy on COVID-19, the Lagos State model. My guest already seated will be talking about what she's got for us this morning. But I just want to take you through some figures because the latest updates on COVID-19. And as we speak, even yesterday, the Center for Disease Control still brought out some, figures. Another 643 new cases of COVID-19 in Nigeria, out of which 230 were in Lagos. Oyo State recording 69 new COVID-19 cases. The Federal Capital Territory, 51. Edo, 43. Osun, 35. Rivers, 30. Ebonyi, 30. Kaduna, 28. Ogun, 27. Ondo, 23. Of course, Plateau with 20, Benue with 17 confirmed cases, Enugu 16, Imo 10, Delta, coming up with 6, Kano 4, Nasarawa 2, Kebbi 1, Ekiti 1, and of course, that's how it all went. So 643 new confirmed cases. Now, the total confirmed COVID-19 cases that we have in Nigeria at the moment is about 34,259, out of which 13,999 have been discharged and 760, unfortunately, have lost their lives. All right, my guest is here to take us through what's happening, the Lagos State model, what are some of the issues that have been cropping up, and how best we can deal with it. So joining me right now is Shola Hassan. She's a State Health Educator, Lagos State Ministry of Health. Nice to have you join us. Good morning, madam.
Good morning.
And you're welcome back to Traffic Radio.
Thank you very much.
Great. So let's talk about the Lagos State intervention on COVID-19. What's the latest update with COVID-19 in Lagos?
Thank you very much. The Lagos State government has done a lot concerning COVID-19 response. Apart from our isolation centers that we have the positive cases that have been admitted, we also have we have increased test centers.
Okay.
And Lagos State government has also approved private hospitals, about 3 private hospitals that have been accredited, to do testing.
Okay, so they've also joined the...
Yes, they've also joined, to do the testing so that we can have a lot of people that can access test.
Okay.
And then the Lagos State government also has provided test kits,
right,
so that people can access the test. And I think that's why we are having a lot of cases, increase positive cases in Lagos because people are having access, to the test.
Testing facilities.
Yes.
All right, so we're having more testing done in the state, and that's the government's resolve to just ensure that these testing facilities are available. But is this something that one can easily access? If I want to do a test now for myself for COVID-19, is it readily accessible?
It's readily accessible. We have we disintegrated the test centers into local government areas.
Okay.
So we have test centers in local government areas. We have test centers in Naima. We have test centers at IDH, that's Mainland Hospital, and then we also have test center at NCDC,
right,
also at Yaba.
Okay.
So even in the local governments, they can access the test.
Right. All right then. So we're having much more cases, like you said, and that means.
And then we're also having a lot of contacts that we are tracing.
Right.
Because if somebody tests positive. Then we also have to trace the people that have been in contact with that person.
How is that contact tracing? How's it going?
Yeah, it's going well. It's going well. The staff that are doing the contact tracing,
right,
they are housed in a separate place so that they will not mix with the community and they will not continue
to infect other people.
Yes.
All right. I know that not too long ago the Commissioner was talking about some people who were not ready and refusing to show up for treatment haven't tested positive. But we won't go into that now because I know that's another issue entirely. But let's talk about the outcome, the psychosocial effects of those who test positive to to COVID-19. Let's look at that. I'm getting some feeds of heightened anxiety amongst people as relates to COVID-19. Can you shed light on this?
Yeah, a lot of people believe that because we're having problems with people believing that the COVID-19 is real. So that's where we're having a lot of panic. We're having a lot of anxiety in the community. But be that as it may, we are on top of it. We have a lot of community sensitization, community mobilization, which is supported by NOAA, National Orientation Agency. Yes, it is in collaboration with Lagos State. It is supported by UNICEF, and we are trying to enlighten people so that they can know that COVID-19 is real, and whenever they test positive, they should just accept the fact that it is they are positive, and then they should access care.
Right. So it's not a death sentence, right?
COVID-19 is just like any other disease. It's just like maybe you're having malaria, or you're having hypertension, or you're having diabetes. It is treatable. And you can see that we have a lot of cases that have been discharged, and it's not that when you get into the isolation center, you've received your death sentence.
Right. So people do recover. A lot of people are recovering.
Lots of people are recovering.
So there's no need for fear.
No, there's no need for fear. There's no need for panic. There's no need for panic.
All right. So what would you say, Shola Hassan, what would you say to people who still doubt? You know, they're having this feeling. Well, if you say COVID-19 is real, how come we've not seen somebody in my neighborhood that has come down with COVID-19? What would you say to them? Yeah, because they feel that anybody that is having COVID is just like the person is having malaria. But we know that the signs and symptoms of COVID although it is similar to somebody that is having malaria, but it is different. If you look at it, the signs and symptoms of COVID include general body weakness. Right. It includes extreme high temperature.
It includes
coughing,
sneezing, which a lot of people that have malaria also have. But the difference between a COVID-19 symptom is that you're going to have a dry cough. The cough is going to be intense and it's going to be dry. It's not going to be productive. So, and then the temperature, having used paracetamol or anything, it still persists. And then you also notice that the person that has COVID, the person that has COVID-19, the general body weakness, the sneezing, and it will persist. Even with the fact that that person is using either paracetamol or anti-malaria medicine.
Even the treatments that are needed. All right, so that's why they need special care.
Yeah, they need special care. And then, Lagos State is now looking into treating people at home.
Home-based care.
Home-based care. Because the isolation centers, they're full, and then we need to include the people in the community. The people in the community also, so that they will accept the fact that COVID is real. We want to involve the people at the grassroots.
All right. Before we talk much more about this home-based care and what the government is doing, let's reflect a bit about stigma for those who have been coming down with the coronavirus disease. So, what is the government doing? What's the position now for us to really stop the stigmatization that's going on across town?
Yeah, we've been putting a lot of protocols in place. So that, and then the government is also putting all this so that the
advocacy campaigns,
advocacy campaigns, so that the people that have COVID-19 will not be stigmatized. It's because we are saying that COVID-19 is just like any other disease, just like hypertension. You don't stigmatize somebody that has hypertension. You don't stigmatize somebody that has diabetes.
That's right.
And then we also notice that some agencies, some workplaces, they have been laying off their staff because of COVID-19. It's somebody that has COVID-19 and has recovered. So it is only when that person goes, gets infected again. And we don't know how far that is true, concerning reinfection.
Yeah, because some research have proven that if you've got it once, probably you must have developed some levels of immunity.
Yes.
Okay.
Yes.
So there's no need for them to be doing that. I mean, laying off their staff.
We are trying to implore people that they should not, lay off their staff when, they come down with COVID. Because you can never tell. Anybody can come down with COVID.
Right, it could affect anyone, right?
Yes, it could come.
All right, then Lagos Traffic Radio 96.1 FM. This morning, we're stepping up the campaign on COVID-19, and taking us to the classroom is Shola Hassan, who's the State Health Educator, Lagos State Ministry of Health, and that's our focus this morning. I'm sure that you have one or two concerns, even as the program moves on this morning. Let's talk more about some of the interventions which the government has brought in place. You were talking about home-based care, which is the next level right now.
Yes.
How is that program going, by the way?
Yeah, we're trying to train the local government personnel, our ward focal persons, and then we are trying to train build the capacity of the stakeholders, so that they will be in the front. They will be our frontline people at the local government level. They will be the ones to be, canvassing that what COVID-19 is, how it can be prevented, how to take responsibility. Like the governor has said, that we should all take responsibility about the prevention of COVID-19 by the use of our face mask and hand washing, regular hand washing, and the use of hand sanitizer in case we don't have the hand washing kits around us. Yes.
Right. Now, the level that we are now, because I know that COVID-19 and the battle against COVID-19 has gone in different phases. There was a time we're doing the containment stage, and later on, again, it got to the community transmission. So the point we are right now, we've seen high levels of community transmission.
Yes,
is that correct?
Very high level of community transmission.
Right.
And that is why we want to start the home-based care, and that is why advocacy and community sensitization is going on. So that it's going to be from a bottom-up approach.
All right.
Yes. So that the community people, our opinion leaders in the community, our they will be informed, and then they can also talk to their people in the mosque. They can talk to them in the church. They can, although we know that the churches and the mosque are not operational now.
Right now.
Yes, right now.
But you want to use their leaders as...
Yes, we want to use their leaders as advocates. So that they can also, talk to them in the community.
So are you organizing any kind of webinar, any kind of forum for you to enlighten them?
Yes, it is in the pipeline. In the next week, we are going to have all those, organized in the local government, and then it's so that we can build their capacity, and they will be able to know what to say to their people. Let
me ask you, as a state health educator, what have you noticed about the hygienic level of Lagosians? Has it changed?
The hygienic level of the people in the state has not changed at all.
It has not.
It hasn't changed at all. But
that's why this preaching, these sermons that we've been doing.
In the last 1 week, when I said UNICEF supported a program, the community motorized campaign in all the local governments. So, and then with some little enforcement, some level of enforcement, we have seen that people are using the mask now. Instead of putting it on their chain, they have started using the mask now. Initially, after the ease of the lockdown, people stopped using the mask. They felt that because the government has eased the lockdown, that they can start their normal life activity. But we should realize that the use of the mask is going to be with us for a while.
Okay.
And COVID-19 also is going to be with us for a while. So we should learn how to use that mask.
And that is born out of personal responsibility, right?
Yes. We should learn how to use the mask, washing our hands, regularly, and then, keeping the social distance.
Right.
Keeping the physical distance of 2 meters apart. It's very, very important.
Yes, I was just tracking COVID-19 on the global stage just early this morning.
Okay.
And what I realized about countries and the use of face masks. Now, Japan has the highest in terms of compliance. And you know the reason? Because the citizens have just decided to take personal responsibility. So when you go to Japan, you go to Tokyo right now, virtually like 80 to 90% of their populace are making use of face masks.
Yeah.
Now, the journalist went to ask them, why are you, taking it? They said, well, we want to protect our own people, and because we want to do that, let's see how we just comply. This is in sharp contrast to places like New York, to places like UK, and other great cities like that. So you are saying now that Lagosians should also take this kind of responsibility?
Yes, they have to take responsibility. The people in the market, I am just appealing to them. Some of them are not keeping that 2 meters apart, the physical distance.
Right.
And it is one of the ways at which we can contact coronavirus. So hand washing also is very important. The mask, protects. Whenever we talk, we can have particles of the. If somebody has the virus, as he or she talks, the particles comes out from the mouth, and then it gets to the other person who is not maintaining that physical distance. Yes, from the other person.
And have you taken this campaign to the markets?
Yes, we've gone to the markets, we've gone to the motor parks, we've gone to various communities.
Okay.
In the local government.
Just to pass this message?
Yes, to pass the message.
And each time you do that, what's the reception? How do they receive you?
In some areas, they are highly receptive. But in some areas, they will tell you, please go away. The government is using it to siphon as a scam. They're using it to siphon money, But in some areas, they listen, and then they will tell you, yes, okay, can you give us the mask? If you can provide the mask, then we will use it. And what we tell them is that, look, the mask is not expensive. All you need to do, we are not asking you to go and, be buying the surgical mask. You can always use the face mask. I mean, the cloth mask.
Right.
Yes. It is, you will sew it in 3 layers, and then you have about 2 or 3, because you use it once a day.
Okay.
So after using the mask, you wash it and then iron it, and then
you can use the next day.
You reuse.
Right. Now I still cannot connect really when people say government is siphoning money with COVID-19. Rather, government is spending much more money than it's supposed to be spending.
Honestly, that is what I always tell them when we go out for our mobilization or sensitization. I say, this money you're talking about, the government is using it to buy the personal protective equipment for the people that are taking care of the infected COVID-19 cases.
You have a situation where the government is taking full responsibility for catering for those who test positive.
Yes.
That's gulping lots of money already. You have a situation where the government is buying protective equipment, right?
Yes.
That's gulping money already. You have a situation where the government is trying to get drugs and all of that, trying to get test kits.
Yes.
So where is the siphoning coming in from?
It's not coming from anywhere.
Okay, all right. I'm going to just hold you on that. Lagos Traffic Radio 96.1 FM. It's time for you to join the conversation right now on 0809 912 0777 is the numbers that you can connect with us on the program. We're talking COVID-19, and of course, we're looking at it from the Lagos State government's response. What have you noticed? What are some of the deep thoughts that are in you that you want to express to my guest this morning? Hello there, good morning.
Yeah, good morning, moderator.
Yeah, what's your name?
My name is Mr. James. I'm calling from Magodo.
Mr. Jones from Magodo?
James.
Oh, James from Magodo. All right, go ahead.
Yeah, and I agree with Madam there for sharing more light
okay.
on this pandemic. But the problem I want to take my argument is where the right of the public, why they are not taking it so seriously. Because the federal government or the state government are not transparent foreign countries like Algeria, they will show us what is happening in the isolation center itself. And those that are dying, they will show us what is happening. But here, we not even see anything going on in the isolation center. All we keep hearing is one party is 500 die, 500 is 200 is that. We keep hearing figures. What is hearing figures? We are not seeing, we believe here is what we see.
So, James, let me ask you, do you believe that COVID-19 is real?
For me, as a person, I believe.
Okay.
I've had an account, I have people who have said, I love somebody very close, but I've not witnessed like somebody very close to me, like maybe like relative or something. I have a friend that said, this is what, So what I'm saying that let them be transparent, let them show us what goes on the operation center. They will see it, but we don't see.
Okay.
Figures. Tomorrow night they said 500, tomorrow 200. But I want to see people, I want to see videos like this, what is going on that session. So we say this, we want to know. Like, let me just digest a bit. When they came out with this, they show people who are mad and not eating very well, or who are very lean.
Right.
The kind of symptom, how they hate people, how they look like.
Right.
Kind of, it's always on people. But here now, we don't even see, we don't even know.
Okay.
Because somebody that has this, you won't even know.
All right.
I mean, they have the symptom.
Yeah. Okay, then.
Yeah.
All right, James, thank you so much. Okay, so James wants government to be much more transparent by bringing up much more. All right, we'll see. Let's take some more from our callers this morning, and then we will allow you to respond to all of them at once. Hello, good morning. Hello.
Hello, good morning.
Good morning.
Is this Traffic Radio?
This is Traffic Radio. What's your name, sir?
My name is Ola, and I'm calling from CI.
All right, Ola from Victoria Island. Go ahead.
Yes, please. I was just listening to what the discussion about the pandemic.
Mm-hmm.
And in reality, I would agree with the last caller who said the government, in all fairness, they have not been transparent.
Why do you say that?
In the dealing of this pandemic. Yes, we know that COVID-19 is real. I myself believe COVID-19 is real because I've had multiple occasions to go to visit them, what's it called, the Yaba Isolation Center.
Okay.
Quite a number of people bringing out their relatives, as in dead people. I have a few of my relatives who are passed on, though elderly ones who got contacted and have passed on.
Okay.
So, why would the government keep saying this is the social number of infected people? Yes, we are not seeing that. Apart from we individuals that know that okay, they have relatives who have contracted it and everything. But we keep giving us numbers, like ridiculous numbers that does not look realistic.
Why do you say? What makes you feel that these numbers are ridiculous?
And another thing is that health workers, as in the frontline workers who are doing this, why should they hold them their allowance? Because I don't have a proof, but from what I've heard from people who are healthcare workers who are complaining, they said the government are holding them allowances.
Okay.
Even in Abuja, I have a close friend of mine whose cousin is a frontline worker who said the government don't pay them their allowances.
Right.
They are telling us that they are spending millions and billions of naira to end COVID-19.
Right. So,
my brother, let's not be realistic.
Right.
Sentiments are bad.
Okay. All right. You made your point. Thank you so much. It means that a whole lot more in terms of advocacy needs to be done so that government can put this to bear. But you can still talk to us, 0809-912-0777. We're talking COVID-19 this morning. Talk to me. Hello there.
Hello, good morning.
Good morning.
How are you doing, sir?
I'm good. Please turn down the volume of that radio.
Hello, can you hear me now?
I can hear you. What's your name?
Ismaila Yakubu from Magodo.
All right, Ismaila Yakubu. Go ahead.
Government are spending a lot of money because of this COVID-19. And when you look at it, is lockdown. Some transport motor, from one state to another state, carrying passengers. Some are carrying 3, 4. What is government doing about that?
Okay.
Every day, the cases of COVID-19 is increasing every day. There is road safety on the road. There is police on the road, and some motor are still carrying 3 passengers. 4 passengers.
Okay. All right. So, but do you believe that COVID-19 is real?
Hello.
Hello.
Excuse me.
Hello.
Actually, my name is Prashant. Okay, I am traveling with Ismaila. Okay.
Okay.
This Lagos Express, in the Ibadan Expressway, it is too heavy traffic. Okay, today heavy traffic. Every motor going yellow bus, full passengers. They are full, and full means completely packed.
So they're not observing the social distancing.
Nobody checking who is going. Nobody, no surveillance, nothing. Every motor having full passengers. I don't know how COVID is coming to like this because of this one.
Right.
So they are going to different states.
Right. So what's your own name? What's your own name?
My name is Prashant.
Prashant. Okay. So you are talking with Ismail, and you just had to share that experience with us. So what you're saying now is that most of the commercial vehicles are fully loaded.
They are fully loaded, and some of the vehicles they are giving a distance, one seat, 2 passengers, and most 90% of yellow buses and other interstate they're carrying full. There's no social distance, nothing. They are just putting the mask as just giving a pretending that I'm using mask, nothing else.
All right then.
So
Thank you so Prashant.
COVID is coming like this.
Yeah, so Prashant, thank you so much for sharing that experience with us. We're going to also send that
No,
across.
I'm little bit. They are in front of my eyes. I can see everything.
All right. Thank you for your call. So that means we have lots of people that are observing this. But like we said, it's not about the government, okay? So it's about me.
It's about the people.
Yes, me and you, and how we take personal responsibility. I'll take one more before I get back to you, madam, so that you can respond to some of those concerns. Hello, good morning. Hello.
Mr. Victor, good morning.
Good morning.
Yes, my name is Abdul Malik.
Abdul Malik, nice to hear from you. Where are you calling from?
Presently, I'm in Unilag.
Okay, all right, then go ahead.
Yes, I agree with previous scholars, and I also disagree with the government numbers.
Oh, you feel those numbers are cooked up?
They are not. They are underreported.
Oh, they are underreported. So you feel that we have much more confirmed cases in Nigeria?
Yes. I'm a trained microbiologist by profession. Now, you see, how mosquitoes, how they hide and how they manipulate our insecticide. It's the same way this virus changes strands.
Okay.
Due to our weather, we get.
Okay.
Most people don't know this. Corona has been existing since. This virus has been, but this one is a different form of virus, which is the COVID-19.
Right.
Now, we have more cases than what government is reporting. Now, contact tracing. They are doing contact tracing, but in Lagos, the population is way too much. Right. And our markets, our transportation system, everything, you can't give the real figures.
That's right.
Why I agreed with what the previous scholars are saying about the isolation centers and not. You see, we have Nigerians, or I'm sorry to say this, when you show them what is really happening, a rumor by everybody.
So you mean government is right in that way then?
Yes.
Okay.
When you show people what is really happening in that isolation center, when they see how people are breathing, people will be afraid and they will know it's real.
Okay.
You get? So that's why most people will be saying this and that and this is not real. But Yoruba is anybody call them more.
All right.
There are so many families who are really afraid of this thing. And stigmatization. Whosoever had coronavirus and overcome it will be more afraid
to talk about it.
Not even to talk about it. We'll be more afraid of anybody outside the street.
Right.
Because that person could many Tony.
Okay.
So the person will be afraid.
Right. All right. So, Malik, because of other people as well, but thank you so much for sharing this with us. We really want to appreciate you. He's a microbiologist and he's also trying to break it down. So, Madam, let's get back to this. From what you heard from the responses so far, what do you make of the feeds?
I want to say thank you to all the people that have called in, this morning to shed light or to raise one concern or the other. the caller that said that we are not showing the cases at the isolation center.
Yes.
You can recall that I talked about stigmatization.
Right.
And that in some companies, they have been laying off COVID-19 positive cases that have even recovered. So that is the more reason why a lot of the confirmed cases that are in the isolation centers, that is why they have said people should not disclose their identity. There was a time a compilation was done,
right,
concerning the people at the isolation center. Their faces were not shown, but they had them talking, and a lot of them shared their experience on how they contacted, why they need to keep the rules, right, of all the precautionary measures. So
government is just taking it lightly so that we do not exacerbate the fears of people.
That is it.
All right.
That is it.
All right. But what about
and
those?
Then, somebody talked about allowances.
Mm-hmm.
The allowances of the frontline workers have been paid.
I know the governor was talking about that
yes.
2 or 3 days back.
Yes.
Yes.
The government is not owing anyone now. All the allowances, have been paid. And then in the area of the commercial vehicles, we have already engaged the chairman of the National Union of Road Transport Workers.
Right.
Yes, but you know that he is not going to be everywhere. Initially, the drivers they pick 3, on a row.
Right.
Or sometimes 2. The Marwa people 2.
Right.
But because he is not everywhere, that is why.
Yeah. So kind of enforcement is
it's difficult.
Right.
But we will still get back to him.
Okay.
And then tell him that.
And how about carrying along the enforcement team, the police force and FRSC, all of these ones?
Yes.
I hope you guys are taking them along with this.
Definitely.
Advocacy
FRSC, yes.
Okay. All right.
And some other law enforcement agents. Yes.
Right. All right. So as we begin to take this to the end this morning, Mrs. Hassan, let's reflect. What do you want the Goshen's to do from this point on as relates to COVID-19? What's the word from the ministry?
The word from us is that people should take responsibility. They should try to wash their hands regularly, use their face mask properly, not on the chin and not on the forehead. They need to use it properly, because a lot of people that we see outside, the mask is on their chin. And then sometimes the mask is just covering the mouth alone.
Okay.
Even those that are using it, the mask is on their covering only their mouth. So the mask should be covering both the mouth and the nose.
Right. So that's why.
And then there was also one observation: the use of a face shield.
Okay.
Some people are using the face shield. It's still okay, but
it's not 100% proof.
Yes. If you want to use the face shield, you have to use the face shield with the face mask.
In combination.
In combination. That's the only way you can protect yourself.
Right.
Yes. You have to. And then hand washing is also very important.
Okay.
Yes.
At this point,
is also
for us
very
to continue
important
to maintain high levels of hygiene.
And then we should not forget about the physical distance.
Social distancing.
Yes, social distancing.
It's very key.
It's very important.
So what would you say to people who are still organizing, probably birthdays, having 1 or 2 ceremonies in their homes, just to say, well, should be our Nikoni, that kind of thing.
Yeah, because they don't know who has it. So they also have to take responsibility. If you want to organize birthdays, you don't have to organize birthdays that will be more than 20 people. Okay. And then you also have to, maintain physical distance, in such an instance.
Right.
Yes.
Madam, it's nice having you in the studio. Thank you so much for being here.
Thank you very much.
All right. So the conversation this morning have been woven around stepping up the campaign on COVID-19, looking at it from the Lagos State government model.